Good evening to everyone and welcome to today's session. The third most common topic in the last 15 years, All India and NEETPG question bank in pharmacology is autonomic nervous system pharmacology, which you have to be emphatically sure. Roshan, Sanjeet, Krishna, Sridhar, Satya and many more who are across the country. Lipolysis in adipocyte. What are the receptors which are involved? It is the beta 3 receptors. So you should know what are the various receptors and what is their action among the adrenergic receptors, which is the most important topic, doctor. Lot of students will be weak in this topic. I want to make you the Mahagyani in this very important topic. So you have alpha 1, alpha 2, beta 1, beta 2, beta 3, beta 3. Alpha 1, what does it basically do? Alpha 1 lead to vasoconstriction. If you stimulate alpha 1 receptor, there is a vasoconstriction. Any vasoconstriction increases the total peripheral resistance. Because of that, there is an increased blood pressure. And when you are angry and you have high blood pressure, what happens to your pupils? They dilate. So, mydriasis is caused by the alpha 1, and there is a increased closure of the bladder sphincter. So these are the important effects of the alpha 1 is what you need to remember. Then what does alpha 2 cause? Typically between alpha 1 and alpha 2 there is a small misnomer you should remember. Alpha 1 are postsynaptic, whereas alpha 2 are presynaptic. Generally we think 2 is post and 1 is pre, but alpha may reverse hota hai. Alpha 1 is postsynaptic, alpha 2 is presynaptic is what you should remember. If the alpha 2, which is the presynaptic receptor in the CNS, if you happen to stimulate it, that will decrease the norepinephrine release, the release of norepinephrine. Decrease of norepinephrine in turn will lead to decreased vasoconstriction, so vasodilation occur. And that is the reason we use alpha 2 receptor agonists, the stimulants on the alpha 2 receptor, as antihypertensives like clonidine is what you need to remember. How does clonidine act? Clonidine is an alpha 2 agonist, and that decreases the norepinephrine release, and that typically will lead to the antihypertensive effect of the clonidine is what you need to remember. Alpha 2 stimulation also leads to inhibition of the acetylcholine release. So not only norepinephrine release, even acetylcholine release. Similarly, alpha 2 stimulation will inhibit the insulin release is what you need to remember. So these are the three important functions of alpha 2 stimulation. Alpha 2 is called presynaptic. Central alpha 2 receptors, when they are stimulated, they decrease the norepinephrine release, they prevent sympathetic output, and that is the reason we use the alpha 2 agonists as antihypertensives like clonidine is what you should remember. Then alpha 2 agonists also decrease and inhibit the acetylcholine release, inhibit the insulin release, you are not going to forget. Now comes the beta 1. Beta 1, there is only one heart, one beta. So beta 1 is in the heart. It will speed up the heart rate. So tachycardia occur if the beta 1 is stimulated. The beta 1 stimulation increases the myocardial contractility. Contractility is what you should remember. And also beta 1 stimulation increases the renin. Release of the renin is what you have to emphatically remember. Then what about the beta 2? Beta 2 is there on the vascular smooth muscle. Vascular smooth muscle. It leads to relaxation of the vascular smooth muscle. That is the reason typically it leads to vasodilation. Beta 2 stimulation lead to vasodilatation is what you have to understand. Because of that, beta 2 stimulation lead to decreased total peripheral resistance. And also you have the smooth muscle and the bronchi. So it lead to bronchodilation. Beta 2 agonists are all salbutamol, salmeterol, they are all what? Beta 2 agonists that lead to bronchodilation. Then beta 2 stimulation also increase the glucagon release. Glucagon release. That is the reason hyperglycemia can occur because of the beta 2 agonists is what you should remember. Then beta 2 agonists also lead to the dilatation of the smooth muscle of relax the smooth muscle of the uterus. So if anybody has a preterm labor, you want to use a tocolytic to delay the delivery, then you will be using beta 2 agonists typically as the uterolytic agents because they decrease the tone of the uterus and relax the uterus is what you have to remember. Then finally you have the beta 3. Beta 3 is there on the adipocytes. So that is the reason they lead to lipolysis. If beta 3 is stimulated, you get lipolysis, and also it leads to release of energy when the fat undergoes beta oxidation, lipolysis. Energy is produced, and that is the reason the beta 3 has a thermogenic effect is what I want to underscore to all of you. So this is the gyan of autonomic nervous system, doctor, which you have to be very, very sure about. So summarize, doc. Beta 1 receptors, they increase the force of the myocardial contraction. Heart is more inotropically contracting if you happen to stimulate beta 1. They increase the rate of contraction. Heart rate is higher with beta 1 stimulation. And sometimes excessive stimulation of beta 1 lead to arrhythmias is what you have to remember. So summarize, on the heart you have beta 1, on the adipose tissue you have beta 3 and also beta 1, vascular smooth muscle beta 2, airway smooth muscle beta 2, and the kidney, the renin release from the juxtaglomerular apparatus, the renin get released because of the beta 1 receptors are there on the juxtaglomerular cells is what you need to ultimately remember. Right? Very good. Riyaz, finally, thank you for coming to Hyderabad, and I hope Riyaz received a free subscription post-paid. Riyaz want to be a pediatrician. After Riyaz become pediatrician, he will definitely pay for the subscription that he has taken, right? So good, I am happy to see that. Now doctor, if you activate the beta 2 receptor, there is a bronchodilation is what you have to ultimately remember. Similarly, what is the effect on alpha 1 receptor? Alpha 1 receptor, if you stimulate, it lead to vasoconstriction and rise the blood pressure. That is the reason alpha 1 receptor antagonists like prazosin is an antihypertensive. Prazosin is a alpha 1 receptor antagonist is what you have to fundamentally remember. Now doctor, beta 2 receptor, beta 2 agonistic action, what does it lead to? Now it is a game. There are 50 questions. All these questions are based on this funda only. So we will try to finish last 15 years All India Pharmacology. There are totally 600 questions, doctor. NEETPG All India, 50 questions in the last 15 years. Almost all every entrance exam they ask 2-3 questions. So once your concepts are strong, inevitably you will be able to answer in the tomorrow's exam. So in the next 1 week, I am going to make you the champions in pharmacology. But the only thing you should promise is after the class is over, go to the onlinembbs.com, go to the video library and review AIIMS may what are the questions on ANS pharmacology. PGI may what are the questions in ANS pharmacology. We have all those video discussions, PPTs, everything is made available. Just please do the review, right? Now doc. So beta 2 agonistic activity lead to bronchodilation. About the beta 1 receptors, where are they present? They are there in the juxtaglomerular cells and also on the heart is what you need to remember. Beta 2 selective agonists, where are they useful? They are bronchodilators, hence useful in asthma. Now comes a very interesting question, doctor. You have given a drug and that drug typically led to increase in systolic BP, increase in heart rate, but a decrease in diastolic BP and an increase in cardiac output. So what is possibly this drug doing and how does it act is a important question. So you should remember, if the cardiac output has increased and the diastolic BP got decreased, it means it should be a vasodilator. It should be a vasodilator. So that is the reason it should be acting as an agonist at both beta 1 and also beta 2. Beta 1 because there is an increase in heart rate and the systolic BP, and beta 2 because there is a vasodilatation and a fall of the diastolic BP is what you have to emphatically remember to answer this question. So now doctor, let us be very sure. There are two famous catecholamines we all are using, epinephrine, norepinephrine. Then what are the other important inotropic agents? Isoprenaline, dopamine, dobutamine, so milrinone, amrinone. About all these drugs, 4 or 5 critical points frequently asked in the NEETPG. You have to be master and champion. So ANS pharmacology is the only part of pharmacology where batti marna bahut kam hai. Logically answer karna, logically reason out karna bahut zyada hai. That is important. Okay. Now doc, let us talk about epinephrine. Epinephrine. So what does epinephrine does? Epinephrine. Epinephrine causes the vasodilatation in the skeletal muscle and liver. Our major body blood supply is going to all our muscles. So if there is an intense vasodilatation over there, how does it cause? It causes by stimulating beta 2 receptors. That is the function of epinephrine. Because of this vasodilatation, there is a decrease in the diastolic BP if you give epinephrine. There are certain locations where epinephrine lead to vasoconstriction, but this vasodilatation that it significantly causes by beta 2 stimulation on the skeletal muscle and liver overwhelms all the vasoconstriction everywhere else. So the net effect is a fall of diastolic BP and a fall of the total peripheral resistance is what you have to basically remember about the epinephrine's effect on the vasomotor tone. Then, so diastolic BP falls if epinephrine is given, beta 2 stimulation, and there is also a fall of TPR. You are not going to forget. Then, what is the effect of epinephrine on the heart? It causes an increased heart rate because of the it causes an increase in the heart rate. Then what is the effect of it on the SBP, systolic BP? It increases the systolic BP. Generally, what is the common sense? If there is a rise of systolic BP, there should be a reflex bradycardia. I know, doctor. So you will think epinephrine, since it causes an increase in systolic BP, why is it not causing reflex bradycardia? But the point is, epinephrine is also causing vasodilatation, fall of the total peripheral resistance, and leading to fall in diastolic BP, no doctor. And because of this fall in diastolic BP, there is a tachycardia. Because of rise in systolic BP, there is a reflex bradycardia. But the overall effect is tachycardia. The amount of fall it causes the diastolic BP leading to tachycardia. This is more overwhelming than the bradycardia that it causes. So remember, epinephrine increases the heart rate, increases the systolic BP, decreases the total peripheral resistance, and vasodilatation it causes, and a fall of the diastolic BP. That is epinephrine. Every time in entrance exam, NEETPG, यही क्वेश्चन पूछता है. अगर आप गर्मा गर्म याद नहीं रखे तो मैं वो कोचिंग गया, ये कोचिंग गया, क्या फायदा है? Topper is there inside you, doctor, inside you, sitting inside you. You are already a topper in NEET UG, undergraduation. You have to bring out the topper once more back into the game. Like Bahubali returns, like that you have to bring him out for the PG entrance also, right? So, all these concepts, you should be strong, and examiners' ultimate fight is, do you have any small weakness, Achilles heel in the concept? वो पकड़ने का कोशिश करता है, and I don't want you to, I will never let you lose the game like that. So cardiac output is increased, increased heart rate. These are all the features of epinephrine. Now, what is not true about noradrenaline? Norepinephrine is different from epinephrine. What is true about noradrenaline? Noradrenaline increases systolic BP just like epinephrine, but it increases the diastolic BP. It does not decrease the diastolic BP. Epinephrine decreases diastolic BP, but norepinephrine increases the diastolic BP, and because of that it leads to reflex bradycardia. So there is a decreased heart rate due to noradrenaline is what you need to remember. So what happens with noradrenaline? Noradrenaline has a significant effect on alpha 1 receptors. Norepinephrine has strong influence on alpha 1 receptors. This is what you need to remember. So because of this alpha 1 stimulation, it leads to vasoconstriction, and the vasoconstriction intensely will increase the diastolic BP. Because of that, there is a reflex bradycardia is what you need to remember. So let us quickly summarize epinephrine, norepinephrine. You are going to answer along with me. Okay? So this is the most important class, doctor, because हमको कोई भी पढ़ाते नहीं, सिखाते नहीं, हम भी सीखते नहीं फर्स्ट ईयर में. When we are taught autonomic nervous system physiology, हर्री बर्री में पढ़ लेते. So at least the time now for you to recoup from the gaps. So you have one effect on vessel. What type of receptor does it act? What is the effect of it on TPR? What is the effect on diastolic BP? What is the effect on systolic BP? What is the effect on the heart rate? This is going to be abhi chai pe charcha with Dr. Murli Bharadwaj today. एक एपिनेफ्रिन है, एक नॉरएपिनेफ्रिन है. एपिनेफ्रिन typically is a vasodilator. Just before we discussed, no doctor, what is epinephrine doing? Epinephrine predominantly is acting on beta 2 receptors, whereas norepinephrine acting on alpha 1 receptors. Because of that, what does it have? This lead to vasodilatation, whereas this lead to intense vasoconstriction. Epinephrine lead to a fall of the total peripheral resistance. Norepinephrine rises the total peripheral resistance. Because of the fall in the total peripheral resistance, diastolic BP falls with epinephrine, whereas norepinephrine causes rise of the lead to rise of diastolic BP. But both of them ultimately will increase the cardiac output. That is the reason the systolic BP is increased by both of them. But the fall in the diastolic BP is more than the rise of the systolic BP because of the epinephrine. Hence, the overall effect is increased heart rate, whereas the rise of both diastolic BP and systolic BP lead to reflex bradycardia if you give norepinephrine. Hence, the heart rate decreases. Heart rate decreases. ये अभी याद रहेगा ना? Lifelong याद रहेगा ना? That's right, doctor. You are pocketing 1 mark for coming today evening. Okay? So, sympathomimetic drug which causes decrease in heart rate. अभी पढ़ा ना? Norepinephrine, strong vasoconstriction, rise of both SBP and also diastolic BP, and that lead to development of bradycardia is what you need to remember. Which is a powerful vasoconstrictor? It is the epinephrine. Norepinephrine is not there, right? Ideally, norepinephrine should be there. Norepinephrine, by its action on alpha receptors, that is the alpha 1 receptors, typically lead to vasoconstriction. What sympathomimetic drug you use in anaphylactic shock? We use adrenaline, the epinephrine in the anaphylactic shock. What are the most classical location for giving adrenaline infusion whenever there is a cardiac arrest? It is intravenous administration is the most preferred one. If you stimulate alpha adrenoceptor, what does it basically lead to? Alpha 1 receptors, if you stimulate, it lead to vasoconstriction. Alpha 1 receptors lead to vasoconstriction is what you need to remember. So if you look at alpha 1, alpha 2, what is the main effect? Just before we studied that, alpha 1 smooth muscle contraction, whereas alpha 2 is in the brain. Alpha 2 is presynaptic. It decreases the release of the norepinephrine and sympathetic output. Alpha 1 lead to vasoconstriction, decreased glandular secretion, and in the gut it lead to relaxation. In the heart, alpha 1 lead to arrhythmias. In the eyes, it lead to pupillary dilatation. Alpha 2 decreases central sympathetic flow, decreases the insulin release and platelet aggregation it lead to is what you need to understand. Now, what is the major metabolite of noradrenaline in the urine? Vinyl mandelic acid is the major metabolite. Norepinephrine banta hai epinephrine. What is the type of reaction, biochemical reaction that converts this? You can see how frequently NEETPG में हर एक बार एग्जामिनर पकड़ पकड़ के आपको दिक्कत देने को कोशिश करता है. कुछ भी दिक्कत नहीं है आपको. आप तो महाज्ञानी हैं अभी, right? So you are going to tell examiner a fitting reply like an American Scud missile. Yes, I know I'm expecting autonomic nervous system pharmacology based MCQ, and this is my question for this evening, and you need to attack the examiner. So that is how you should prepare for the exam. Now, norepinephrine become epinephrine by the methylation. So tyrosine, by the action of tyrosine hydroxylase, becomes dopa, and tyrosine hydroxylase has tetrahydrobiopterin as its cofactor. Dopa become dopamine by the action of the dopa decarboxylase, and dopa decarboxylase has pyridoxal phosphate as its cofactor. Dopamine become norepinephrine. For that you require dopamine beta hydroxylase, and for that hydroxylation you have vitamin C ascorbate as cofactor for dopamine beta hydroxylase. Norepinephrine become epinephrine by the action of phenyl ethanolamine N-methyl transferase, and for that you have S-adenosyl methionine, which is the methyl group donor, is what you need to remember. Invariably one question आएगा biochemistry में, definitely it is going to come, it will come, it had come, and you are going to answer it. Okay, doc? Now, what is that rate limiting step in the epinephrine synthesis? Is a very, very important question, and who inhibits that? It is the metyrosine. So, metyrosine is a synthetic inhibitor of tyrosine hydroxylase. Just before we have seen all these steps, tyrosine hydroxylase, dopa decarboxylase, dopamine beta hydroxylase, and phenyl ethanolamine N-methyl transferase. Out of all this, tyrosine hydroxylase is the rate limiting step, and that is the one which is inhibited by the metyrosine. So if you don't want catecholamines like in pheochromocytoma, you want to inhibit their production, you have to inhibit the rate limiting enzyme, and that is the tyrosine hydroxylase, and inhibited by metyrosine is what you need to remember. Now doc, let us be very sure on this very, very important flow in the catecholamines. You are listening to Dr. Murali Bharadwaj on pharmacology, 600 MCQs Garma Garam and 600 concepts Garma Garam from the last 15 years of AIIMS All India NEETPG question bank. Now doc, tyrosine हो गया, डोपा, इस शादी के लिए पंडित जी कौन है? Tyrosine hydroxylase, which is the rate limiting step, and that is being inhibited by metyrosine. Then this dopa need to be picked up by the vesicles, and that need to be converted dopamine to norepinephrine. So this pickup by the vesicles, uptake by the vesicles of the dopa, for it to get converted into norepinephrine, that step is stopped by your reserpine. How does reserpine act as a antihypertensive? A norepinephrine का release होता है ultimate शादी. इस बारात में there are lot of villains who try to stop the release of the norepinephrine ultimately. One villain is metyrosine. Tyrosine to dopa conversion, tyrosine hydroxylase, metyrosine inhibits. Dopa need to be picked up by the vesicle and that step is inhibited by reserpine. Then after the norepinephrine is being formed, it is typically released and norepinephrine comes down. Now there are certain drugs that stimulate this norepinephrine release. What are they? That way norepinephrine release stimulants act like sympathomimetics. So what are those sympathomimetics which are centrally acting, which increase the release of the norepinephrine and sympathetic outflow? Amphetamine, tyramine, ephedrine, ये सारे चीजें नॉरेपिनेफ्रिन का रिलीज को प्रमोट करता है. एम्फेटामाइन, टायरामाइन, एफिड्रिन. Whereas there are certain drugs which inhibit the release of the norepinephrine. What are they? Bretylium and guanethidine. Guanethidine are the drugs that you need to remember which inhibit the release of the norepinephrine. Hence they are sympatholytic, anti-sympathetic are the bretylium and guanethidine. That's what you need to remember. Then once this norepinephrine is being released, it will go and act on the receptors and lead to vasoconstriction. That level, right, your alpha blockers basically go and prevent the action of norepinephrine on the receptor after it got released. Then this norepinephrine is made to be reuptaken. It is reuptaken and recaptured by the vesicle. That's how the norepinephrine is cleared. So if something happens to inhibit this reuptake, what will happen? Norepinephrine become increased and that goes and acts on the receptors and sympathomimetic effect occur. So what are the inhibitors of the recapture and reuptake of the norepinephrine, doctor? Tricyclic antidepressants and the cocaine. Tricyclic antidepressants like imipramine, cocaine, they inhibit the recapture of this norepinephrine and hence norepinephrine gets collected in abundance and that typically will have sympathomimetic effect is what you need to basically remember. Yes, story hai doctor. You are going to promise me you will take a pen and paper, go back to your friends, explain them that there is no rocket science in autonomic nervous system pharmacology. Now doc, Dale's vasomotor reversal phenomena, where do you see? We typically see with adrenaline. We typically see it with adrenaline. So if you happen to give the intravenous injection of adrenaline, because of its alpha 1 stimulation, it lead to rise of BP. But later, it lead to beta 2 agonistic effect and lead to vasodilatation and a fall in the BP. Then, if you happen to give alpha blockers, then what is the effect of the alpha 1 stimulation by the adrenaline, doctor? That rises the BP and the fall in the BP is because of beta 2 agonistic activity. So if you happen to give a alpha blocker and give adrenaline, then it has no effect on the alpha 1 because of the blocker that you gave, and it has only effect on the beta 2, and the effect of the beta 2 is what? Vasodilatation and fall of BP. So that is the reason, instead of a rise of the BP followed by the fall, if you give adrenaline, if you happen to give a alpha blocker and then adrenaline, then there will be only fall in the BP, which is called the Dale's reversal, vasomotor reversal phenomena. A patient was started on norepinephrine, then how do you know that it is acting? It is the rise of the mean arterial pressure is an important index that the norepinephrine is acting. So this is a very important question, doctor. A lot of times examiner will ask, if you happen to give epinephrine, the mean arterial pressure, what is the effect on the mean arterial pressure? So epinephrine will cause an increase in heart rate, inotropy, because the beta 1 receptor mediated action, and it causes the vasoconstriction, and but it also lead to vasodilatation, and that is the reason the net effect of it is not much on the mean arterial pressure if you happen to give epinephrine, is what you need to remember. Whereas if you give norepinephrine, typically the norepinephrine increases the heart rate, increases inotropy, and increases vasoconstriction only, no vasodilatation. Hence both systolic and diastolic BP, both of them are increased, and mean arterial pressure also is increased. Whereas a fall of the diastolic BP with a rise of the systolic BP with a not much of effect on mean arterial pressure is the feature of epinephrine. ये दो graphs examiner देख के आपको देगा एग्जाम में कल NEETPG में और पूछेगा, देखो भाई ये नॉरएपिनेफ्रिन है या एपिनेफ्रिन है? What will you tell? Suppose if there is a rise of the systolic BP, rise of the diastolic BP, rise of the mean arterial pressure, all the three rise, that is norepinephrine. Whereas there is a rise of the systolic BP but a fall of the diastolic BP and the mean arterial pressure is not affected, then that is epinephrine, is what you need to basically remember. Now doc, which is that sympathomimetic amine which increase the contractility of the heart but reduces the heart rate. अभी पढ़ा ना, नॉरएपिनेफ्रिन के वजह से सिस्टोलिक बीपी राइज होगा, डायस्टोलिक बीपी राइज होगा, because of that the mean arterial pressure rise होगा, because of that there's a reflex bradycardia. So that is what examiner वो क्वेश्चन पकड़ के बैठ के आपके लिए वेट कर रहे, आप कब आएगा, लड्डू दे देंगे आपको, right? So you are going to say, I am a smart NEETPG aspirant because I attended Dr. Murli Bharadwaj Chai Pe Charcha every day evening and gone to onlinembbs.com to revise 1000+ hour video lectures with about 80,000 MCQs discussed like this with the PowerPoints. Everything is there in abundance for you. Now doc, what is the effect of adrenaline when you happen to administer after the alpha receptor blockade? Already we discussed that there is a fall in the BP, not a rise followed by fall, only fall in the BP is what you should remember. So now let us quickly summarize, doctor. What are the various alpha receptor antagonists? Alpha receptor, alpha blockers. How do you divide? Alpha blockers classification. Favorite question of the examiner, doctor. Now, you have non-selective blockers of alpha 1 and alpha 2, which you need to remember. You have selective, obviously, and miscellaneous. Among the non-selective, you have two types: reversible, irreversible is what you should remember. So, non-selective, alpha 1 and also alpha 2 blocker, which are reversible. What are those drugs? phentolamine, tolazoline, and phentolamine are the reversible alpha 1, alpha 2 non-selective alpha blockers. Then which is irreversible, both alpha 1 alpha 2 non-selective blocker, phenoxybenzamine is a non-selective alpha 1 alpha 2 irreversible blocker. Then if you look at selective blockers, you have selective alpha 1, selective alpha 2 only blockers. Ab bolo bhai, what are alpha 1 selective blockers? Prazosin, terazosin, doxazosin, alfuzosin, then bunazocin, tasmulosin, silodosin, ये सब चीजें अल्फा 1 सेलेक्टिव ब्लॉकर्स होता है. प्राजोसिन, टेराजोसिन, डॉक्साजोसिन, ब्रोनाजोसिन, alfuzosin, tasmulosin and silodosin. Then what are alpha 2 blockers? Yohimbin, only experimental, we don't use it clinically, and idazoxan are alpha 2 selective blockers. Then you have miscellaneous alpha blockers, and that is ergot alkaloids. Ergot alkaloids are miscellaneous, selective भी नहीं बोल सकते, non-selective भी नहीं बोल सकते. That kind of category is ergot alkaloids, which are ultimately, their mechanism is by the alpha blockade, is what you need to remember. Now summarize, doctor. Because of the alpha 1 blockade, what happens? All that we have studied till now. There is a vasodilatation, fall of the resistance, fall in the BP and postural hypotension. Then alpha 2 blockade, alpha 2 receptors are there in the presynaptic area in the brain, and any stimulation of that decreases the sympathetic outflow, any inhibition of that increases the sympathetic outflow. So that is the reason there is an increased vasomotor tone, is what you need to remember. And there is a vasomotor reversal of Dale if you give an alpha blocker before the epinephrine. Then on the heart, what is the effect of alpha blockers? Alpha blockers lead to reflex tachycardia because of the fall in the mean arterial pressure, is what need to be remembered. And if you happen to give the alpha blockers, what happens? Alpha agonists like the ephedrine, they are used to clear the nasal congestion. If you give alpha antagonists, it leads to nasal stuffiness. In the eye, alpha antagonists will lead to meiosis. In the GIT, they increase the intestinal motility. In the kidney, they decrease the GFR, is what you have to ultimately remember. Now, what is the effect of alpha blockers on the urinary bladder? In the alpha receptors, there is a subclass called alpha 1A receptors. If this alpha 1A receptors happen to be blocked, then there is a decreased tone of the smooth muscle in the trigone of the bladder, sphincter, prostate. So that is the reason we use the alpha 1A blocker like tasmulosin in order to improve the urine flow in case of the benign prostatic hyperplasia. Then what is the effect on reproductive system? They cause contraction of vas deferens and that result in ejaculation through alpha receptors, and the blockade will result in impotence. typically lead to impotence because the contraction of the vas deferens will result in ejaculation prematurely and also in supply of the blood flow leading to impotence. Now doc, if you happen to give intravenous administration of norepinephrine in a patient who is already taking atropine, anticholinergic le rahe to, what is the combined effect of it? The combined effect of it is there is an increased heart rate. Atropine bhi heart rate badayega. Atropine bhi heart rate badayega. But if you give only norepinephrine without atropine, what is norepinephrine doing? It is causing a reflex bradycardia. But atropine will not let that bradycardia happen. So the net effect of it is increased heart rate. Agar norepinephrine akela diye to, what do you get? Reflex bradycardia. Whereas norepinephrine atropine ke saath mila ke diye to, you get increased heart rate is what you need to remember. Biphasic reaction of the blood pressure. Where do you see? If you administer what? If you happen to administer adrenaline, there is a biphasic reaction of the blood pressure. So, if you happen to give adrenaline, initially there is a predominant alpha 1 action. So, there is a rise of the BP. Then later on there is a beta 2 action, and that is the reason there is a vasodilatation and fall of the BP. So, that is what typically happens, called biphasic reaction. The sympathomimetic drug on both D1 and D2 and also beta 1 receptors, but not beta 2 receptors. Which one? It is dopamine. Dopamine has an effect on all the D1, D2 and also beta 1. Now comes a garmagaram PowerPoint slide, doctor. आप onlinemmbbs.com वीडियो लाइब्रेरी में पीपीटी भी मिलता है आपको, आराम से आप रिवीजन कर सकते, नो नीड ऑफ राइटिंग, राइट? सो you should remember this. What are alpha agonists? Mixed alpha and beta agonists, only beta agonists, and dopa agonists, dopamine agonists. And what is their affection towards the various receptors? What is their receptor affinity is an important question. Now, first thing, phenylephrine methoxamine. I am talking about the alpha agonists. Phenylephrine methoxamine, similarly clonidine. What are they? They are alpha agonists. Phenylephrine methoxamine, their effect on alpha 1 is more than alpha 2, which is far more than beta. Almost they are alpha only, in that alpha 1 more than alpha 2. That is phenylephrine and methoxamine. Clonidine, alpha 2 is more than alpha 1, far more than beta. So, since clonidine is alpha 2 agonist, it lead to decreased sympathetic outflow, whereas phenylephrine, hence clonidine is used as antihypertensive. Phenylephrine is alpha 1 stimulant, hence vasoconstriction, hence used to decrease your nasal congestion as a decongestant is what you need to remember. Then what are mixed? Noradrenaline and adrenaline, both of them are mixed alpha and beta. But noradrenaline if you take, alpha 1 is equal to alpha 2, right? And beta 1 is more than beta 2. That is norepinephrine. Then if you take adrenaline, alpha 2 is equal to alpha 1 and beta 1 is equal to beta 2. That is the affinity of adrenaline. Then what are the beta agonists? You have dobutamine, isoproterenol. इस डोपामिन को नीचे लिखेंगे. Isoproterenol, terbutaline, albuterol, ritodrin. What are they? They are beta agonists, only beta agonists. Dobutamine, isoproterenol, terbutaline, albuterol, ritodrin. Dobutamine, if you take dobutamine, beta 1 more than beta 2, far more than alpha. Beta 1 more than beta 2. Dobutamine. That's the reason dobutamine will make your heart race, and we use dobutamine to stress your heart and do a 2D echo to know any occult ischemia in the heart. Isoproterenol, it is beta 1 is equal to beta 2 far more than alpha. Then terbutaline, albuterol, ritodrin, ये सब चीजें beta 2 more than beta 1 far more than alpha. But beta 2 more than beta 1 is terbutaline, albuterol and ritodrin. Then how about the dopa agonists? Dopamine agonists are mainly dopamine, only one drug. This is D1 equal to D2 and that is more than beta, which is more than alpha. That is dopamine. So this is one important slide, doctor. Slide मिलेगा PowerPoint में, मगर इसको पढ़ना, याद रखना, reproduce करना एग्जाम में, क्योंकि questions will come based on this slide. So since I have a fear that you guys will postpone to master this table, along with you I am singing along, not that you don't know how to read that simple slide. So just go back to the onlinembbs.com video library. Please pick up this particular class. It will be written as AIIPG NEETPG Pharmacology Chapter 3 Autonomic Nervous System Pharmacology बोल के लेसन का नाम रहता है 30,000 Hot MCQs कोर्स में. ये वीडियो, ये PowerPoint और ये सारे 50 MCQs will be available like a quiz also. You also play a quiz and know how good you are doing, right? So that is what you are going to promise me. Now doctor, dobutamine, where does it act? It acts on beta 1 receptors just before we studied. So doctor, alpha plus beta affects non-selectively बोले तो epinephrine है. Alpha 1 affects mainly बोले तो noradrenaline. Alpha 2 affects mainly clonidine. Beta affects and non-selective beta 1 plus beta 2 means isoprenaline. Beta effect with some alpha effect means dopamine. Beta 1 mainly means dobutamine. Beta 2 mainly means salbutamol and isoxaprine. So same thing, multiple बार पढ़ो, हजार बार पढ़ो, मगर autonomic nervous system pharmacology में महर्षि बनो in order to get the top rank in NEETPG. Now doc, D1 receptors increase the renal blood flow when? If it is a low dose dopamine. So low dose बोले तो कितना dose? 1 to 2 microgram per kg per minute means it selectively activates D1 receptors and that typically increase the renal blood flow. Then intermediate dose means 5 to 10 microgram per kg per minute. It activates beta 1 receptors in the heart. But at high doses means more than 10 microgram per kg per minute, dopamine activates even alpha receptors and lead to intense vasoconstriction is what you have to basically remember. Same things examiner हर एक एग्जाम में पूछ के सताने की कोशिश करेगा, मगर हम रोने वाला थोड़ी है। और नीट पीजी 2020 का वर्ल्ड कप टॉपर्स है हम। So you are going to answer all these questions. 25 out of 25 pharmacology में correct मार के आप बोलना we are Dr. Murali Bharadwaj students, right? That's a promise. So dopamine at 1 to 2 microgram per kg per minute lead to renal vasodilation because it's a low dose. Dopamine is preferred in shock because it lead to renal vasodilation. Dopamine at 3 to 5 microgram per kg per minute predominantly, what does it do? Once more, you see how frequently it is asked. AIIMS November 2015 also. Typically, it acts on alpha 1 receptors. Dopamine typically acts on the beta 1 receptors. Half life of dopamine kitna hota hai? This is too much, right? Yeah, you need to know because you are all going, some of you are going to be cardiologists, and that's the reason examiner is rechecking. Am I picking up the cardiologists or not? So doc, 2 minutes. 2 minutes is the half-life of the dopamine to check whether your heart has ischemia or not in the dopamine stress echo, right? अगर dopamine stress echo नहीं है तो 2 मिनट में मर जाएंगे, इसलिए 2 मिनट of half-life of dopamine you are not going to forget. So the onset of the action of the dopamine is within 1 to 2 minutes is what you need to remember. Alpha 2 agonists which are used in glaucoma is which one? It is brimonidine. Clonidine ka bade bhai brimonidine is a alpha 2 agonist. Clonidine जाके central nervous system में alpha 2 agonist के action के वजह से it will bring down the blood pressure, whereas brimonidine acts on the eyes and typically is used in glaucoma is what you should remember. So this is the typical brimonidine tartrate ophthalmic solution which you need to at least एक दवा को देखे तो you'll get some confidence. Yeah, I've seen the package of it. Then what is true about dexmedetomidine is an important question. Dexmedetomidine is a centrally acting alpha 2 agonist. Central acting alpha 2 agonist means it will have a sympatholytic effect. It is used in critically ill patients, used in intravenously in anesthesia. So dexmedetomidine, if you look at the alpha 2 receptors and their functions, alpha 2A, alpha 2B, alpha 2C, alpha 2D, life is miserable, right? Subtypes are also there. Alpha 2A, anesthesia, analgesia, sympatholysis, sedation, anxiolysis, increased cognition. NEETPG के लिए अच्छा cognition बढ़ाना है तो alpha 2A ज़्यादा काम करना. Alpha 2B, instead of that, if alpha 2B functions, that lead to hypertension, anxiolysis. Then alpha 2C lead to anxiolysis and drug withdrawal. So this is the alpha 2 ka, which is a presynaptic receptor. You need to remember. So dexmedetomidine, like clonidine, typically acts centrally and decrease the sympathetic outflow is what you need to understand. Which is a centrally acting muscle relaxant which acts on alpha 2 receptors is an important question. So tizanidine is an example of a centrally acting alpha 2 receptor basically. So एक बार tizanidine tablet भी देख लो ताकि आप याद रखेगा, right? So good to see Madhu, Roshan, Shivendra and many more. So what are the centrally acting muscle relaxants? Let us get clear on this concept, doctor. Concepts, especially muscle relaxants. You're all seeing the World Cup cricket, no? Muscle relaxants are very important if you are a sports physician, right, doc? So, what are the centrally acting muscle relaxants? Kama. क्या होता है? Kama नहीं, CAMR. Centrally acting muscle relaxants. They are mephinicin congeners is one class. Benzodiazepines is another class. GABA mimetics is another class. Central alpha 2 agonists. Even central alpha 2 agonists also. Alpha 2A, 2B, 2C, 2D hai na? So central alpha 2 agonists are also the muscle relaxants is what you need to remember. So mephinicin congeners क्या होता है? Mephinicin itself, then carisoprodol is a centrally acting, then chlorzoxazone, right? Then clomazanone is also mephinicin congener, and methocarbamol. So these are all the centrally acting mephinicin derivatives, which is a centrally acting muscle relaxant. Then among benzodiazepines you have diazepam. Then what are GABA mimetic centrally acting muscle relaxant, doctor? The baclofen and thiocolchicoside. They are GABA mimetic. A lot of times question was asked, well, how does baclofen act as muscle relaxant? It is centrally acting GABA mimetic agent. Then tijanidine. Now comes the examiner's question. Tijanidine is central alpha 2 agonistic agent is what you have to ultimately remember. So which is a non-catecholamine sympathomimetic drug. Ephedrine typically is a non-catecholamine sympathomimetic drug which acts like a vasoconstrictor. So if you look at the various nasal decongestants, they can be adrenergic or intranasal steroids. Ephedrine, nefazoline, oxymetazoline, phenylephrine, pseudoephedrine, they are all topical and oral route nasal decongestants. Beclomethasone, fluticasone, mometazone, they are all intranasal steroids which can act like nasal decongestants. Which is that beta agonist that we give to stop the preterm labor? Ritodrine classically. Just now we studied beta 2 agonism lead to smooth muscle relaxation in the uterus. So these are the Ritodrine tablets, doctor. Utero Relax 10. Very commonly given drug. So if you look at the various tocolytic agents, adrenergic agonists like Ritodrine, similarly calcium blocker like nifedipine, then max sulfate also is a tocolytic. Labor pains aane se rukega. Then oxytocin antagonist like atosiban is another tocolytic. Daru pillow, ethyl alcohol is also tocolytic. Nitrates, halothane are also tocolytic is what I want to underscore to all of you. Now which is a LABA, long acting beta 2 agonistic drug is a favorite question of the examiner. Solmeterol, if you are having a nocturnal asthma, exercise induced asthma, you like to use a beta agonistic agent which is long acting LABA, salmeterol. So, in simile, a salmeterol and fluticasone propionate inhaler, very commonly prescribed. Nocturnal asthma and exercise-induced asthma. Long-acting beta agonist is which one? Once more, formoterol is also LABA. So fundamentally, you have a short-acting, non-selective, non-catecholamine beta 2 agonistic agents. Metoprolol and phenytoterol. Then which is a non-catecholamine beta 2 agonist, which is short-acting and selective. Albuterol and terbutaline. Then which is a long-acting selective beta 2 agonist, which is non-catecholamine. Formoterol and salmeterol, arformoterol, carmoterol, indacaterol, they are all considered to be long-acting LABAs, which are selective LABAs, is what you need to remember. Then, what are the catecholamine beta 2 agonists? Ephedrine, epinephrine and isoproterenol, they are all the catecholamine by structure and beta 2 agonists is what you need to remember. So, this is one table you have to be very sure about. Nivedita is asking, sir, dopamine at a dose of 3 to 5 action is due to D1 or D2? Good question. At low doses it acts on D1 and lead to vasodilation, and higher doses not only D1 even D2 also it starts acting. That's what you need to appreciate. Graceline says, sir, your classes are too good, sir. Definitely. Graceline, quickly call our helpline and buy a subscription. Then I will accept that you are enjoying the classes. But Graceline, our after a long time I am saying Graceline. Graceline is our last year student, right? Yeah, that's right. So doc, all you guys are the wonderful companions for me every day evening. आपके साथ नहीं मिले, आपके साथ नहीं खेले, आपके साथ कुछ चर्चा नहीं हुए, then this life is not worth living. So much I am addicted to you, right? Very good, Graceline. You joined MD Pediatrics. Proud of you. Proud of you. I'm proud of you. So, you should contribute some pediatric MCQs, some good clinical cases. Send me the videos. Nowadays, exam is all video based, right? So, WhatsApp some classical cases, nephrotic syndrome, or if you happen to see a good case. So, try to send with the consent of the patient any good clinical finding based videos, etc. Right? So, all our Sunday classes, we are trying to Sunday mock tests. So, tomorrow we will give you the link of the Sunday grant test, NEETPG grant test. Image based questions, clinical VNet based questions, new questions in the NEETPG pattern with negative marking, with a timed and graded response test we will send you. You share that link with all your other friends also and solve the paper and then participate in the YouTube discussion on every Sunday afternoon 12 to 3 p.m. So, whenever helpline calls some students, they say, रोज फ्री बता रहे ना सर, इसके लिए फीस पे करने का क्या जरूरत है? But definitely you are paying fee, buying subscription will help us to sustain the organization that we are running. So please do also become a paid student, though the classes are all free. But being paid student, you get all PowerPoints, mock tests, video library of almost 5 to 6,000 video lectures on spanning 1,000 hours of duration. So take an opportunity, or at least get one friend who will pay, so that you and your friend, both of you get the subscription activated. So that is the deal, right? Yes. Sure, Graceline, whenever you get time, please join us and that makes us feel to sail along with you guys. Yes. So doc, I leave to you the literature, the summary of the various selective beta 2 agonists. Now, hemorrhagic stroke is implicated as a adverse effect of which important drug? Phenylpropanolamine. You have to be very careful. Then about alpha 2 agonists, what is accept? Alpha 2 agonists are used in hypertension. They are used in glaucoma. They are used as muscle relaxant. But prazosin is not alpha 2, it is alpha 1. Is what you need to remember. Alpha 1, that is antagonist, blocker. So just now we discussed what are the various. Alpha 1 blocker is prazosin, terazosin, doxazosin. Now doc. So beta agonist in asthma, what do they lead to? Typically they cause bronchodilation, they abort an acute attack. They are all true, but they are not anti-inflammatory is what you should remember. Then what acute exacerbation of the asthma, what is the drug of choice? Favorite question. Beta 2 agonist. Salbutamol is the drug of choice in acute asthma. So what is the effect of beta 2 agonists? Always remember doctor, beta 2 agonists lead to hypokalemia. They push the potassium into the cell. That is what you need to remember. Whereas, so what is the very common cause of hypokalemia in intensive care unit? In intensive care unit, a lot of people will be nebulized and you will be administering a lot of beta 2 agonists in the acute medical care unit, and that lead to development of intense hypokalemia is what you need to remember. Now, beta 2 agonists which are used in the acute respiratory condition, kya hota hai? Terbutalamine, salbutamol, bambuterol, they are all basically used in the acute clinical management. Which dopamine receptor has got an inhibitory action? D2 has an inhibitory action. D1 is having a stimulatory action. So dopamine is what? Dopamine is a D1 agonist, alpha agonist, beta 1 agonist, not beta 2 is what you need to remember. Once more, the relative receptor affinities you have to be very sure. Where do you use phenyldopam? Phenyldopam is a partial D1 agonist. Partial D1 agonist. This is the typical phenyldopam, like dopamine, phenyldopam. Phenyldopam selectively leads to peripheral vasodilation, being a D1 receptor agonist. And it is given intravenously. And the main indication for the phenyldopam, it is used for the short-term management if there is any severe hypertension, especially in a patient who has a renal impairment. Severe hypertension hai to, you want peripheral vessels to vasodilate and bring down the BP, you use the phenyldopam is what you need to remember. So, suddenly an unexpected question is metoclopramide. Metoclopramide, it acts on chemoreceptor trigger zone, it increases the gastric emptying, and the long-term use of it can lead to gynecomastia, Parkinsonism, and galactoria is what you need to remember. So doc, tomorrow we will take up the remaining questions in pharmacology. Thanks for joining this wonderful evening. Once more at 6 o'clock tomorrow, we will all rejoin. Thank you very much and enjoy a great evening.